Welcome to Penrose Learning, where we make understanding easy.
You begin by confirming the in-check dial model and setting the resistance range appropriate for the patient. This matters because the calibration changes target flow. Once assembled, attach the mouthpiece and filter. Make sure seals are tight. Position yourself or the patient seated upright with a relaxed neck and use a nose clip if needed so air routes through the device. Now take a gentle exhale to functional residual capacity. This primes the lungs and readies you for a controlled inhalation. Next, set the resistance to the prescribed level or start low if you are unsure, because progressive overload matters for training. Once set, place lips around the mouthpiece and inhale steadily and forcefully. Aim to hit the target flow indicated by the dial needle. Make sure to breathe in with consistent effort. Watch the indicator and feel the workload. Repeat the maneuver for the recommended 6 to 8 breaths, pausing to recover between attempts, and adjust resistance upward only when technique is solid. To finish, document the peak flow and the resistance level used, along with any symptoms. This tracks progress and guides the next session. Disassemble and clean the reusable parts, replace disposable filters per manufacturer guidance, and store the device safely. If your readings are unusually low or inconsistent, first confirm the mouth seal and filter orientation, then recheck the resistance notch and repeat the inhalation. If problems persist, consult your clinician for recalibration or device replacement.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.